second sex, and continue like that. That is the thing. That is a, specialty of compound geometric distribution. First is the format. If you take second, third, and all, this will be negative binomial. In case of variety, Z may be heterogeneity due to miscarriages observed or unable to conceive a child with a couple before they have first child. That means until the first child, it's a random variable. It may be a 0, 1, 2, 3, and so on. Okay? If it is 1 and then it will be for the first child, that is a geometric distribution. Some mothers would like to deliver babies until she delivers a baby boy. Okay. Politicians go on contesting until they win. These are all the examples of compound uh, geometric distribution. Individuals go on changing his job until he or she get a suitable job. Such a compound geometric distribution is suitable. This is an example of z greater than 0 or n greater than 0. There are examples of n equal to 0 also, that is z equal to 0, so that they will they will get success at the first attempt. There are no failures at all. That means, okay, there are no failures. Very first attempt they will get success. There are some examples. Some people get suitable partner at the very first attempt. In case of fertility, no miscarriages are observed. Some mothers able to deliver a baby boy at their first child. Politician win election at the very first attempt. In unemployment data, individuals get the suitable job at the very first attempt. Student pass the exam at very first attempt. In, in such type of data, compound distribution having some post, some positive mass at zero value can be suitable choice. These are the examples. I also some papers with my PhD students earlier about the compound geometric distribution or compound negative binomial distribution. Okay, I'll just go to the next one. Okay, this is a random variable z. X1, X2, Xn is ready. N is a random. When n equal to 0, it is z will be 0. This is the value of all these things. Okay, these are the IID gamma we have taken. N is geometric distribution with probability of success P. Okay, that is the thing. And xi's are gamma with scale parameter nu and shape parameter gamma. This is the thing. Okay, probability z equal to 0 is P. And given n equal to n, Zi, you know, sum of the gamma is also gamma, therefore sum of gamma is also gamma. With scale parameter nu and shape parameter is n into gamma. That is the thing. This is the density of gamma, and this probability mass function of geometry. Now we have to combine these two because this is a mixing distribution. Continuous part of the compound geometric distribution. Conditioning on n. Okay, that is this. Okay. Compound geometric distribution when is of z. That is the density. Now Laplace transform of gamma. That is here. Laplace of geometric distribution. We have to obtain both the Laplace transform. Now then we have to combine these two. Combining these two together, you get this one. This is a Laplace transform of z. The combination of both. And the final form of the Laplace transform of compound geometric distribution. That is here. This is the mean and variance. For the identity condition, you have to take expected value of z equal to 1 in the equation 1. And that will lead to the restriction, this one. P mu equal to Q gamma. Q here is 1 minus P. That is that. In all, there are three parameters, and it will reduce to two parameters. One parameter will go after this restriction. Okay, then the variance of Z will become this one. It's based on only two parameters, P and gamma. Q is anyway 1 minus P. Okay. Correlated priority is the extension of shear priority model. There we have only Z as a common shear priority model. Here we have two random variables, Z1 and Z2. Z1 for T1 and Z2 for T2. That is the way. Okay. And this is the condition Z1 and Z2. Z1 is for T1, Z2 is. And here these Z1 and Z2 are correlated here with the rho as a correlation coefficient. Okay, that is there. When you integrate this Z1, Z2, we'll get this quantity. And this is a bivariate priority distribution, correlated bivariate priority distribution. This one, when you integrate. Because it's correlated because Z1 and Z2 are correlated with correlation coefficient rho. Some baseline distribution employed, generalized Weibull. This is a generalized, this is a Weibull distribution, distribution function raised to alpha that gives generalized Weibull distribution. ST cumulative hazard and hazard function. And there are so many subfamilies, exponential, Weibull, several distributions of that, and generalized log logistic. Okay, that is a thing. It's the same way. The distribution function raised to alpha gives a generalization of log logistic. HT, small ht, and other things. Okay. There is a formula for this from univariate Laplace to bivariate Laplace. If you know the univariate Laplace, you can go to bivariate using this equation number 9. Rho is a correlation coefficient. Laplace transform, you know the Laplace transform, just substitute. Okay, in this, you will get bivariate Laplace. These are univariate. All three are univariate. They are sum of the S1, S2. That gives bivariate. When rho equal to 1, it will become shear priority model. When rho is 0, then T1, T2 are multivariate. Rho equal to 0 means they are mutually independent. Rho equal to 1 leads to shear. Right. Now, substitute this in the Laplace transform here. We get this one. This is for the univariate. We can do it for the bivariate. This is the bivariate. Okay, we already have an equation for the bivariate. Just substitute it here. Okay, in the equation number 9. Okay, this is using the some covariance factor, eta z. Eta z is the function of covariance that is there. This is a without priority, then T1, T2 are independent here. When there is no correlate priority, then this is the case. Okay, we have four models in all. Model 1 is a correlated compound priority with baseline model. This one is a baseline generalized model, and okay, and this is a correlated compound geometric with baseline log logistic, and this is without priority. Four models are there with priority 2, without priority 2, with the two baselines. Therefore, 2 into 2, four models are there in all. I'm using the Bayesian estimation. There are two types of, three types, four types in all. T1 is observed, T2 is observed. Both are observed. Okay, this is the reason. Only T1 is observed, T2 is censored. T1 is censored, T2 is observed. Both are censored. For reasons. We have already seen here in the kidney infection data, we have 23, N1 is 23 here. There are 23 observation, 9 observation, 3 observation, 3 observation. In all, there are 22 observation divided into four reasons. Okay, N1, N2, N3. N1 is in the kidney infection, it is 23, it's 9, 3, and 3. Total is how to find F1, F2, F3, F4. These are the formulas. We are using the Bayesian approach. There is some problem with the classical approach, MLEs. One can also have MLEs also, but there is some problem of iterative procedure in the Newton-Raphson procedure. Therefore, we go for the Bayesian approach. We have done some simulation studies based on the size, sample size 50, and we have taken some priors and uniform priors and gamma priors, and this literature you can get it in the Ibrahim and Santosh Achar and Sahu. I'm skipping some of the things because of I'm running out of time. Uh, okay, I'm just taking some hyper parameters A1, A2, B1, B2. You can change the value of hyperparameter also. The sample size is 50. Okay, table 1 and table 2 are estimates that we'll see in the directly in the table 1 and table 2. Parameters, estimates, standard error, lower critical limit, upper KVK values, P values. These are the test for the conversions of the uh, uh, estimates in the MCMC technique. Okay, the estimates are close to true value parameters. That gives the estimates are uh, very good in this case, and standard error also very low. Similarly, in the case of model 3, this is based on the baseline generalized log logistic of kidney infection data. This already are discussed 38 patients in detail. We are now analyzing this data based on these correlated priority models with 5 covariates and 2 say recurrence times. Sorry. And this is the model we are using for that. Some tables. We are having case statistics for the goodness of fit test for the model 1. The p-values of these case statistics are high, and the data uh, agrees with the model. That means it fits the data with this model. Data fits the proposed model, that is the meaning. Okay, this is model 1. Parameters, estimates, standard error, lower. What we see here is the beta 2 is significant. The lower and upper credible limits are both negative. 0 is not included. And here also the beta 5. This is a disease type PKD. Here also both lower and upper are negative. That 0 is not in. That means this beta 2 and beta 5 are significant. All other coefficients, regression coefficients are not significant. And rho is also 0.5 very high, 0 to 1. It's 0.56. That means there is a correlation between T1, T2. That is the meaning. Okay. And model 3, the same thing is also here. Rho is 0.58. Beta 2 also significant, and beta 5. Same as in the model 1. That means you get the similar, almost similar results in the model 1 and model 3 based on the correlated geometric model. These are the ASC-BSC model selection criteria for these four models. The best one is minimum of AIC-BSC DSC, which is the lowest. The model 1, correlated compound geometric with baseline generalized Weibull distribution. 640 is the lowest, 651 is the lowest here. That means this model is better. Even in the base factor, we also done the comparison with the different models. Model 1 performs better. Model 1 is better than 2, 3, 4. All three, other three. Model 2 is better than 4, 3 is better than 1. That means 3 is better than 4. That means model 1 is better than all the remaining three models. That is the thing. Okay, that is the solution. I'm comparing the existing models. Okay, in all the comparing in comparison with all the other existing model, compound geometric with generalized Weibull is lowest ASC, BSc, DSc. That means this is a better model for analyzing the kidney infection data uh, for this uh, correlated variety models. All these are corresponding correlated variety models in the literature. Some conclusion. Sigma is very high. That means there is a variety is present. That means this is a variance of the variety that is very high for both model 1 and model 3. And rho is this, that is also high. There is a correlation between the two. That's why we are using the correlated variety model. Beta 2 is not, doesn't contain 0 in the case. Therefore, the thing is, COVID, the significant is significant. That means the females have lower risk of infection as compared to male counterpart. That is the meaning, interpretation. Okay. Same thing with beta 5. The indicates absence of disease of typical PKD in the patients have lower risk of infection in the model 1 and this one. That is the thing. Okay, I'm about to complete now. This comparison already given in this, and base factor is also there. And we have seen the best model for the kidney infection data is a compound correlated compound geometric variety with the baseline as generalized Weibull distribution. That is better. That is the thing. That is that we have seen from the conclusion. Okay. I think this is the end of my talk. One can also have non-parametric instead of taking baseline distribution. One can also have non-parametric. We'll get semi-parametric uh, correlated variety models also in this case. There are some other distributions are also there. One can also have different baseline distributions in these two. Okay, thank you very much for the patience hearing. I thank the organizers and Professor Satish Kumar and chair of the of this session. Thank you all. Thank you very much. Any questions? Yeah, I'm open to all. Okay. Okay. Uh,
Pandit sir, you have to unmute your mic. I think so.
No, no.
Yeah.
Can you
I can't hear you. Yeah, there is some.
can you hear me now?
Yeah, yeah.
Yeah. So, uh, so if there are no questions, let me thank the speaker again for
Okay.
a wonderful, thought-provoking talk. And I take this opportunity to thank Professor Satish Kumar and his team for giving me this opportunity to share a statistician of high standards. Uh, I thank everybody. So this, I think, over to the organizers.
Okay. Thank you.
Thank you, Professor Anagel, sir, for your wonderful talk. And we are very much grateful to you, Professor. And also, we wish to extend our gratitude to Professor Pandit for chairing this session. And both of you made the first session a grand one. Thank you, Professor. Thank you, Professor. In
Okay.
fact, we
Thank
have
you.
placed some more time for the next session because even though 9:40, next session will start at 9:50. By the time anything you have to add, you have there is time also for the benefit of the youngsters.
I am thankful I given opportunity to deliver a talk in the name of Professor A.M. Matai, a distinguished professor in statistics, well-known professor, and I know him very well. He's very active, one of the active person I have seen at the age, at this age, research and contributing a lot of research, writing books and other things. Thank you once again.
At Canada, and there it is difficult for him to join via online because
Okay.
yeah, that's why. Otherwise, he will be here in this platform.
Okay.
Anyway, we are honored him through this and talk, Professor Hennekel, Professor, and we remember him, and that's great.
Okay.
Professor Pandit, do you want to say anything more?
Yeah, of course. I'm honored to share a session on the in the honor of Professor Matai. So I know him. He's one of the top statisticians, and he has worked in many areas of statistics. Uh, so it is a appropriate way to by giving, I mean, by inviting a eminent statistician like Professor Angal and giving the talk. So I think this is what I want to say.
Great. He at present he is 90, Professor. Professor
Yeah,
Madai.
I know, I know. So last time when I came to your place, I met him. We were together for some time.
Okay. So we hope to have honor him our ISPS next ISPS
Yes,
the
that's better.
90.
That's
Yeah,
better.
yeah.
Vijayawada.
Vijayawada. Yeah. Also our December conference also.
Yes.
Yeah,
Yeah.
it will be here offline more.
Yeah.
Yes.
Yeah.
Yeah.
Yeah. Okay. I will leave up. Okay.
What, Professor? Okay, Professor.
I need a session.
Oh, okay, Professor. Okay.
Okay, because I have to go to office.
Yeah, okay.
So I am attending this from my home.
Okay, that's great. At any time we
Thank
can
you, sir. Professor
join.
Hangal. Professor Hangal.
Yes. Yes. How are you?
Yeah, fine, sir. After a long time.
Yeah.
I
After a
had
long
been
time.
to Pune, but I could not meet you.
Yeah. This time also we are organizing a
Yes,
conference in Pune University
in January.
in the month of January, first
January,
week.
yes.
Uh,
Oh, that's
It
great.
is in the process now.
Yes.
Okay.
Okay, sir.
Okay, okay.
We'll meet some other time.
Yeah,
I hope Professor Letpade is in,
yeah, Latpate is
yeah,
organizing. Yes,
and his team. Yeah, yeah. Okay, okay, okay.
yes, yes, yes.
What about Rajarathan, sir, Professor? Professor Rajaratnam is also with us in this platform.
Okay, okay.
Okay.
Yeah, I know him.
Okay. Yeah, yeah. He's in the design of experiments
Okay.
area, and I hope he has to. Professor, what about DK Ghosh joined here? Anyway, let us take 2-3 minutes gap. 2-3 minutes. After that, we can move to the next session.
Okay.
Thank you, Professor. Once again, thank you so much, Professor David Hannigan and Professor Pandit.
Okay. Thank
For
you.
Good
your,
morning, sir.
okay.
Good morning, good
Hi,
morning,
hi.
sir. Good morning, sir. Uncle, sir. Good morning,
Good
sir.
morning,
Good
Professor.
morning,
Good
Uncle.
morning.
Good morning, sir. Very good morning, sir.
Good
Okay,
morning.
thank you, sir. Thank you.
Good morning, sir. Good morning, sir.
Hi, Professor Venkatesh. Venkateshan, sir. Good morning.
Good morning. Good
Good morning,
morning,
Mr.
sir.
Satish.
Good
Morning.
morning,
Just I
Professor.
was
Good morning.
hearing Angel's call.
Good morning, Professor. So you joined here. So you joined here.
Yeah, yes, very much.
Oh, okay, okay. Good morning, Professor. Good
Good
morning.
morning, good morning.
Good morning, sir. Yeah.
Good
So you
morning,
next week?
Satish, sir. Very good morning.
Hi, Manoj. Good morning,
Good
sir.
morning.
Good morning. Good morning. Good morning. Srilakshmi, please introduce the chair and move to the next session. Let us move to the next session. Professor Jijo sir is with us and
Yes.
speakers also with us. Yeah, please.
Okay, sir. Good morning to everyone. Welcome to this invited session of the 10th International Webinar on Recent Trends in Statistical Theory and Applications. We are honored to have an excellent panel of experts with us today. Chairing the session is Dr. Jijo Evi, faculty at the SQC and OR Division of the Indian Statistical Institute, Bangalore. With MSc, MTech, and PhD in statistics, Dr. Jijo is well known for his contributions to statistical quality control, reliability, Lean Six Sigma, and more. He has over 60 publications and is the author of key books in his field. Our first speaker is Dr. Manoj Kumar, professor at the University of Delhi. His research includes Bayesian inference, ecological models, survival analysis, and progressive censoring with strong expertise in computational techniques. Joining him is Dr. Shipra Banik, professor at Independent University in Bangladesh, with specialization in statistical inference, simulation, soft computing models, and regression analysis. Her work blends theoretical rigor with practical applications. We look forward to an engaging and insightful session. I now invite Dr. Jijo Evi to begin the proceedings. Over to you, sir.
Thank you very much. Good morning to all. This session, we have two presentations. The first speaker is Dr. Manoj Kumar from Delhi University, and the second speaker is Shipra Banik from Bangladesh. So, and since we have almost 1 hour, I request the speakers maybe to complete their talk within 30 minutes. The first speaker is Dr. Manoj Kumar from Delhi University. He will be talking on comparison between classical Bayesian and e-Bayesian inferential procedures for newly developed lifetime distribution under the sensoring mechanism. Manoj sir, over to you.
Okay, thank you, sir. Thanks for the introduction. Am I audible, sir? Am
Yeah,
I
you are
audible?
audible.
Okay,
Yes.
okay, okay. And I attend this program, and a special thanks to Professor Satish and his team for this work. Is my slide is visible or not, sir? Please.
Not yet.
Okay, okay, okay. Is visible, sir? Is it visible? Is visible, sir? Is it visible?
Uh, yeah, now it's visible. Yes.
Yes, it is visible.
Yes, yes.
Okay, okay, okay. So thank you, Professor, for this night introduction. And today my talk is based on the comparison between the classical and e-Bayesian inference procedure for the newly developed lifetime distribution under the sensoring mechanism. Actually, this work is totally based on the Bayesian paradigms for the Bayesian aspect of the selection of the prior distribution, how to select the prior for the inferential aspect for the Bayesian inferential paradigm. In the classical paradigm, the already is sample in hand and give the inference about these lifetime distribution parameters. So these are the contents: introduction, classical estimation of the uh, ETIR, that means exponentiated transform inverted Rayleigh distribution, that is a Rayleigh distribution, which is one parameter distribution. And then after estimation of the estimation of the Bayes estimate of the parameter of the beta, and e Bayes estimate of beta, and simulation study, and there is some data set. And I have considered the different loss function for the decision purpose. Take two type of the loss function: symmetric and asymmetric loss functions. So actually, this distribution has already is developed by many of the authors already, exponentiated families. In 1998, Gupta and Kundu already discussed the baseline distributions and make a distributions. So, but I am not going to that dimension. My talk is totally based on the Bayesian aspect, how to estimate the model parameter and how to utilize for the model parameter and the choice of the hyperparameter. This is the significant of this work. So here we consider the inverted exponential model, and by using the Deuce transformation. Deuce is nothing but the double used by me in 2015, and then after getting the cumulative distribution function for the inverted exponentiated transform and this distribution has very flexible and used for the analysis for the purpose of the medical field as well as for the inverted Rayleigh distribution unit which are beyond the control of the experiment. At that and the second failure X2R2 unit similarly removed from the experiment, and this procedure until the doctor has decided to get the 50%, and then he has to terminate the experiment. In such of this situation, they have used the censoring mechanism, and applying the censoring mechanism for the study of the future aspect, for the planning for the inbuilt of the hospitals, and the engineering aspect, how to the survival of the experiment should be increased. So this is the ideas apply for this one progressive censoring, and the removals of the patients has not fixed. The removals of the patient may be vary from person to person, and that's why here take the binomial distribution applying for the removals which are follows a binomial distribution.